Nou, ik heb nou ruim 30 jaar diabetes.
I've had diabetes for more than 30 years, and in 2000 the first symptoms of neuropathy started to show in my feet. Slowly the nerve cells were dying off, and I'm left with very little sensation in my feet. 1.5 years ago I got an infection in one foot, and this got so bad that the lower leg had to be amputated. Then the question was, what to do now? I had no idea what my future would look like. For my revalidation, I spent some time in St. Martin's Hospital, where I underwent several therapies. One of the goals was to keep me moving. We know, of course, that movement is one of the most important things for people in general, and especially for diabetes patients. During my stay in St. Martin's Hospital, I got a prosthesis to allow me to walk. Longer distances were not possible because my other foot wasn't in good shape either, so I couldn't hope for distances longer than 1 kilometre. Last year I cycled an average of 9 kilometres per day with the BerkelBike. This is mainly for the daily shopping, but often with fine weather I make trips of 50 to 60 kilometres. With the BerkelBike, my action radius has widened gigantically. I'm living near the centre of Nijmegen. This is on a hill which is too difficult for walking, but no problem at all with the BerkelBike. I've become aware that through the movement and the distraction I have with the BerkelBike, I'm no longer suffering from phantom pain. The pain I feel in the toes I don't have anymore, a well-known phenomenon in amputated limbs. In the St. Martin's Hospital I first got to know a handbike, which I liked a lot. But with the BerkelBike you're also moving your feet. I used to cycle all my life. It was the love of my life. During the last years before my amputation it wasn't possible anymore due to the neuropathy. But now with the BerkelBike I can do the things I liked to do in the past once again. This is a fantastic feeling. With the BerkelBike I can also use the train. There's always room for me even if the train is very full. Everybody shifts to the sides. I'm transported as royalty, and I can visit family and friends which were very difficult to reach until recently. I can visit a museum if there's an interesting exhibition I want to see. These are things I wasn't able to do for many years, or if I went, it was with great effort. I should have had the BerkelBike earlier, even before the amputation, when I could walk and cycle less and less, but at the time I had no idea of the existence of such a solution. I can recommend this to everybody in a similar situation.